Hello, good afternoon to all. Welcome to the NORDIC Health 4.0 Amplified Nurse Program. My name is Nika. I'm from Innovation Norway. And today we have at 3 p.m., which is now, we have Ninchat presenting. 4 p.m. with Alto, followed by 5 p.m. the last presentation for today to BSCom. And for tomorrow will be the last day of presentation by the Nordic companies. We have 4 p.m. of TiVo. So the presentation structure will be 30 minutes of presentation and demo, and then followed by 15 minutes of Q&A. So presentation has started since 7, and tomorrow will be the last day. And if you are unable to attend, not to worry, we have all recordings for all the sessions. Just email to me and I can send you the YouTube channel link. And if there are any challenges which are not covered throughout this presentation, please email to me and we'll be on a constant lookout for the solution for you. So my name is Nika. This is my mobile number and my email address. So a total of 17 companies have actually presented or are presenting. These are the 8 and these are the remaining. So without further much ado, let me introduce Bill from Ninchat. Bill will be presenting today, so I'll stop sharing and Bill can take over. So the time is yours.
Okay. Good morning or good afternoon, everyone. My name is Willem and I'm coming from company Ninchat, and I will be presenting our approach to you in just a second. And you are probably seeing my screen right now. Yep.
Yes, all good.
So here in the picture behind you will see our headquarters. So Ninchat is a company from Finland, and the picture is from the city of Helsinki, the capital of Finland, and we are there in the building on the 8th floor. This is our headquarters. Ninchat is we are company making tailored and customized solutions for mainly in healthcare, which enable patient consultation and also automation for different kind of tasks in the area of healthcare. At the moment, there's about 1.5 million patient consultations going through annually through Ninchat platform, and there's about 15,000 healthcare professionals and mental health professionals for treating their patients through our client organizations. And we are a company that is owned mainly by personnel. And this is the only product I'm going to show you that we are doing. So a little background about our company. But I'd like to start that if you could think the work processes, how your hospital operates, or how you're operating like without physical limits, or kind of like how we are used to be doing things and how we are doing them today, and instead thinking like what should we kind of get accomplish with the patients. What would be the target? How would it be if there would be no limits, everything would be possible? How would that go? What would be the dream process when dealing with the patients? How to communicate them, and how would the thing go? So that's kind of where we are starting, and talking about what is Ninchat. So we are kind of set of tools in the area of messaging, and Ninchat is our product is made in a client brand look and feel. So it's a branded white label system. So it resides in the hospital infrastructure, in the hospital website, in the hospital mobile app, patient portal, whatever is the system that you're having. So it's added there. It's not a specific tool that you kind of install, but it's actually it comes into your existing tools, and it's there it's for a specific purpose. So we added, let's say, to customer care, or when you're coming in, they can come into the hospital for operation. So what is the process in that specific type of operation? You're coming to surgery. So how can we help that surgery to happen? So it's always made for very each specific use case and purpose. So we discuss with the team who's actually doing the work. So what are obstacles there, and how is it going, and how can we help that process to optimize? So by using the digital fabric, the kind of how can we connect the dots through internet messaging, so that we go directly to the goal. We answer immediately to customers' issue problem. How can we decrease duplicate work? How can we automate that? And all of that, doing things simpler and more customer driven, and also target driven, leads in increased efficiency. So in a normal process, we can easily reach 3 to 5 times efficiency boost, or we have, for example, doctors who are doing 1,500 consultations in a month through Ninchat, one doctor. And to do this, we use methods like chat, bot, and video, and also alerting people who are not around, but who are needed in the process to be succeeded. So that's kind of where we are coming. So it is more, we are kind of tailored solution for your problem, the case that you're having. How can we make your work better by providing customized views that support the process? So the question is, what kind of digital services do you dream about? So this is actually a real question. We were building for Central Finland welfare region services. So where we're having a team of health centers, of rehabilitation teams, nurseries. So met different teams and asked from these teams directly. So what would you like to happen digitally? How could you like to meet the customers? What kind of things, what kind of questions do the customers ask you frequently? Is there something, what takes too much of your time? And out of this, we got about 6 different concepts that we then delivered in the next time of 4 to 6 weeks, and they're now live, used from scheduled appointments for rehabilitation to family quiz, where you they're trying to collect for social services side information about how families are doing and providing support services to those families that need support, and for maternity clinic support for mothers, or just health centers, basic digital nurse chat tools. So this type of services we build a bunch in just a matter of weeks. Typically, the questions that we look at, we are kind of like having a framework how to approach it. So the questions are, how can we get this when you need to communicate, or there's something that needs to be done with the patient? How can we make that thing succeed at the first time, so that there's no need to return to the issue or send the person to another counter, or not know the answer. So from there we used bots, which is something that also elderly people can do, or people with poor language skills. I'll show it to you in a moment, the approach. So how can we tackle the repetitive things, about 60% of the questions, so that we can liberate and free time from the nurse to actual problem solving, or kind of reduce customer service type of tasks. So and provide 24/7 also in the evenings and nights when the nurses are not around. So how can you tackle that area? Then if the human is needed, so how can we make sure that all the necessary information is there available so that the human can work more efficiently. So there's like less time for asking things and so on. You have a lot of background information. And then when the discussion is done, how can we, what happens after that? How can we fetch the data, process it, automate it, so that we can reduce duplicate work? How does it make your life easier? And then the end to measure. So we to understand where's the success. Was it success? And where do we need to improve? And this way lead by the information. So this is the framework for how we build these messaging views for each unit and each department. And from there we come to the products. So our system, we have built Ninchat in a way that it is very easy for us to build together with you customized views that are fit to purpose for different kind of problems and use cases and other parts that are in your work process. So this we do together, and then the kind of the elements and tools that are behind the views include. We have a web-based professional interface. So a professional interface provides it's for the specific organization. We provide there. We are present for you in the product. We provide you support there for your professionals for using the product. It includes a team, a little bit like a Teams or Slack, but you have the control about the data, and also the external messaging with the clients and all the categorization metadata and the statistics system that is needed for the work process to work. So this is kind of where the professionals for dealing sign in at the Ninchat. And then we've got this embedded client. The embedded client is a minimalistic client that is for the patients to communicate, and it has basically just messaging, files, video call, voice, whatever is needed for there. And this is then connected to your authentication system. It can be connected to the bot to make studies, surveys, pre-audience questionnaires, after surveys, anything that is kind of relating to client communication. So and this is made in your look and feel, and this is embedded into your hospital's booking system, your patient portal, your website, your mobile app, whatever you have that then includes the embedded client. And there we use the bot to increase efficiency. So to provide, for example, service assessment, service direction, so to go to the correct desk. If it's a customer service thing, it goes to customer service. If it's a nurse, it's a nurse. If it's a doctor, it's a doctor. And provide FAQs to trivial questions in the when the opening hours are not available. Also, it can be used to categorize and prioritize. So only certain things go to human and not all. Or you can have the bot to interview clients to actually add forms. When you're having a complex form, it's really natural to interface to have a question. Bot ask you, please, what would you like to do? And then let me ask you a couple of questions. You can actually do a form in a way simpler and more human-friendly way than you would be doing a format that you need first to understand all the parts, because with the bot you only answer the relevant parts. And this is why also like the surveys and studies, we have many partners for doing collecting data by having bot to interview those. The bots, our approach for the bot that is like an in-house bot in Ninchat is a rule-based bot that is always made for your specific need. So that makes it super cost efficient and quick. So during Corona, when we had a lockdown in for one city, when all of their telephone lines exploded, kind of the customer demand. So we created this Corona info bot in just one day, and it started to advise the people about what should be done now in this lockdown situation, for example. And it's also easy to adjust and doesn't require someone to all the time look at the messages and wrong answers and to make the customer experience even like vague, which is very typical to NLP bots, which require a vast amount of training before they can answer even the simplest questions. So this way you can have a working system from day one. Typically, making a bot like this is 1 or 2 days of work together. Here's example of the system. We use buttons and text fields, for example, a person with a poor vision or age of difficulty with thumbs can choose the correct question, and this way then, if necessary, direct to human. Here's example from the city of Oulu vaccination bot. So they know at the health center that the most popular question or most asked question by the citizens is the question that, am I entitled to free vaccination? That's what I ask. And they might need information about a pneumococcal vaccine, or they would need a prescription, or they would need to know when is and how do they get the vaccination. So these are kind of like the most common questions regarding influenza vaccinations, and these tackle 60 to 70% of questions. And if it's not the case, then it will direct the nurse and then have more time to focus on the more specific questions. So it adds also to the value when the nurse's time is connected to the kind of like the difficult issues, in not having to repetitively answer to trivial issues. We've done loads of different types of rule-based bots. For example, the Children's Hospital in Helsinki University Hospital is the symptom navigator. Then there's like for the city of Hämeenlinna, there's the family quiz, where you're kind of playing a game, asking questions about how your family life is going, and they try to identify, for example, if there's issues regarding that they need social support, if there's, for example, violence in the family, or some other like drug, like alcohol, or like stress, or kind of no hobbies for the children. And so this kind of like areas, how can you direct these to the support services, or to have the nurses use strong authentication. We've got in Finland this national ID that the nurse will know exactly who is the other party, and this we can connect to any similar ID authentication system. But the idea is to save nurses time behind that. We have done or have also for business side. So for example, to a pharmacy support for specific medications. So to having a pharmacy specialist contact, a healthcare professional contact a drug manufacturer about difficult cases, or a laboratory system, how to minimize the need for customer support, to providing instructions how to prepare for radiology labs and other areas, or have a very large provider in Finland is using the bot to have an interview regarding COVID situation before going to nurse, save nurse time, pre-process it, and having mentioned already about the COVID info bots, and also regarding that there was also quarantine decision. So if you have made a positive COVID tested, then you would need, for example, a formal quarantine decision for your employer to be given. So then you could have the bot interview all of the relevant areas, and then the human in the end will review the request and make the decision. So this device, it's not a medical device, it just provides information that then the human will review if needed, and that makes it also very fast to deploy. Then what we got is mobile SDK. So if you have an Android app or iOS app, like here, this health service providers, we have the tool set that you can add chat and video and bot messaging inside your mobile app. It's possible to save a couple of hundreds of thousands of euros with this approach, getting the chat and video messaging in your mobile app as a service through the SDK, which is provide easy to brand views so that it looks like your mobile app, but your app will launch inside it in a native code, this messaging area, and the SDK is available at the GitHub. So the native code provides you a bit better customer experience when instead of web interface case. Then we got mobile alert tool for professionals. So this is use cases. So the app has just one button, on off. When you install the app and have it on, log in with your Ninchat account. So then let's say you are a hand surgeon and you have a hand surgeon on-call queue in Ninchat. So then if you have switched the alarms on, then if somebody needs hand surgeon consultation, then the phone will start to ring when this request is made. And it can be a group. You can have 5 hand surgeons all around the county in the region. And all of those who have their system on, when there's a request from a general practitioner somewhere that, hey, I need hand surgeon consultation now, it will simultaneously ring on all of those devices. And then the fastest one will get it. You get a video consultation, and with meta information, you know which hospital was requesting for this consultation. And so you can do reimbursement of the on-call compensation. So this is kind of like to create alert rings for some type of specialist group. We have done it for neurologists, for example, on-call neurologist at the hospital. Then one on-call neurologist can be on call for other hospitals as well simultaneously. And when the alarm comes, they walk in the hospital they are physically at, but then they can go there in a room, log into Ninchat, and then swap the video from the mobile device to the screen in the hospital and do the consultation there on a big screen if needed, if the mobile screen is not enough. Or the system can be used to extend the service hours. You have 3 physiotherapists that you can provide a virtual team that provides wider opening hours than any one of those individually could. Or this is used to free in situations where the requests come from the parents, for example, in a children's hospital, quite rarely. So not all the time. So then you can have the nurse still provide chat support service, but to perform patient work at the patients. And then when the mother or father wants to know about the situation, then it will be stated that, hey, nurse has been notified. Wait, she will come when she has moment from the patient ward. And this way you can actually increase. You don't need to specifically allocate resources to provide customer care while at the ward. Or it can be used to alert night nurses when there's a 3 a.m. on-call chat or video consultation coming in to kind of wake up in a nap room. Or it can be used in a normal on-call consultation to transfer the case to a senior professional, back office professional. Also, with the system, it would be possible when you're having a home care operations, you're having a home care nurse at the patient somewhere at their home. But if you need to have another consultation, like geriatric consultation, physiotherapy consultation, social services consultation, you could actually page using the notifier, get from your mobile device, have there at that moment kind of the thing sorted out, which would reduce a huge amount of duplicate work from there. So there's actually quite diverse world of possibilities when you're kind of thinking, if there's no physical need, or kind of like if you could use these people for a kind of remote office, but have agreed to do the on-call work through this digital alerting tools, how can we provide value add to the overall process with this? So it is quite interesting thought to have, like what would be your needs in this area. Then, okay, in Finland, we've got this national ID provided by the government, so that you can, with your bank IDs, for example, you can strongly authenticate so that the health professional will know for sure that you are you. And for this, we have provide tools how to authenticate either before messaging or during messaging. Example is nursery. So the nursery customer care would likes to provide general counseling because it's more efficient. You don't need to kind of open the client data and store it afterwards. So you can provide anonymous counseling first, but then if during the counseling you need to look at the child's data, then you can ask the patient to authenticate, and then through the available means perform the authentication, and then open the patient data and store it there. So that saves a lot of time and provides convenience and lowers the barrier to ask questions. So it's multiple areas of benefits. Then we've got a group video which also supports authentication. So you know who exactly is there in a group video for different kind of purpose. Internal consultations where you have like doctor, specialist doctor, nurse, patient, or even other like family social services type of meetings where it's been used. They can be scheduled or they can be on call. Then the question, August, where we are going. So kind of what we offer here today is ways to implement for you very specific, for tailored for you services that we are fit to the purpose. So they actually provide measurable benefit from a very early time and are easy to modify according to learnings to improve the nurses' response time or the professionals and reduce duplicate work, shorten the processes, and through automation, reduce back office work, and providing an easy approach from mobile devices or web device, whatever does the end customer have, to communicate with you. And typical model how Ninchat works is through pilot project. Based on the material provided to us, we have made some ideas just for some ideas that could be maybe interesting to you. And we made here for Sing Health. There's the patient discharge. So how to support that so that you would have in your mobile phone kind of like the discharge assistant that would provide you escalation to human if needed, if there's any kind of complication or any kind of question about how to do home care. So easy ways to do that, or maybe leave a message for the specific situation. Also, it could be used to screen the population, to have send over SMS a link to a vast amount of people when they click it and answer the questions. So it would then do the prioritization of the people who would be called in and who not, how to do that. So to have a kind of the relevant people bubble up from this mass communication, and to use notify use cases for example internal consultation. So these are just ideas that could be studied further. For energy, the empowering the patient. So for example, before you're coming to event, you could receive the bot to, hey, we're having operation, and this is how you arrive to the facility. And remember to not to eat, and let's check that there's no any open cuts, let's say between the toes or anything. And then for the internal consultation and alert rings, plus also client care, so any related to customer care or towards the nurse consultation, how to make the customer experience kind of the best in the necessary situation with the human link. And then for IFIS, as we are a white label platform, we could also provide tools to be further provided. So for example, a distribution, we are looking for distribution partners as well. So how to let's say provide a specific set of sets for nurses or home care operations that could be offered either by his or his partners to the relevant stakeholders. So also wider possibilities are there. The way forward with us is typically there's a let's try Ninchat decision, and then we will have a briefing meeting where we are looking at the questions of like which units would be interested to try these new tools, and what would be kind of like how would we want to kind of improve the operation, what would be the targets and what kind of ideas there are. And then based on this briefing, we will provide the demo environment, and from there together we would finalize it, and then we could even train the professionals in the demo environment and then just go live. And typical project length for a small pilot is good to have from the decision to go live in 2 to 6 weeks, and a 6-month pilot cost with Ninchat is something depending of the ambition of the level is from the 20 to 40,000 euros. So this is Ninchat presentation. So I'm looking forward to have a discussion and other questions that you might have. Thank you.
Thank you, Will. So now we are open for Q&A, so you can actually unmute yourself to ask a question, or if not, you can also type it in the chat. Yeah, so go ahead. Maybe I can start with the first question to Will. Will, just want to understand for the chatbot, how easy it is to train the machine when we do have a new question.
Okay, so basically the training, the chatbot is a rule-based question, and is always for a very specific purpose. So we know kind of the area. So then we will look at the data. We will see kind of like what bubbles to human. And so kind of what kind of messages come through to the human. So then is there something that we can more kind of catch from the bot. So that is first we will have this meeting with the people who are actually providing the service, and they know which are the 5 most common things that are being asked from them, and from there we make this kind of good first try, and then we'll see what comes through after that. So that's a way, and then of course you can do analysis from the discussion data, or look at the bot statistics, or you could have the button there to say, hey, yes, thank you, this answered my question, and or leave a feedback. So there's many ways how you can collect the data, but in our experience, very often when we are looking at let's say specific area, for example, this kind of like a survey or a nurse consultation or coming to operation. So it's a very fixed set of issues, and it's a very common that people are asking the same question. So now the idea here is to make the window so that it will be understandable by the people who are coming in, so that it must not have too much information. It must have the right information. The information that is something that it's read and understood by the patient, and then you get the benefit, because then they will not go to wrong places. They will inform if they need to postpone the operation, or if they are asking about the COVID vaccination. So they don't ask it from the telephone, but they will be exposed to it in this environment. So it's really actually delicate to have it. It needs to be easy. And that's why we need to build it together, and also with the people who are actually there in front line in your organizations, to actually who are exposed to all of this pain that is coming from there. So then having this discussion, then we can actually, and it's working together. So we're really interested in your problem, the core problem, and how can we fix that? How can we help you? So it's kind of very far from technology. Actually, it's more about human behavior and psychology, and also having easy access.
So in your existing customer who are using the chatbot, is it something that is updated and managed by the nurses, or is it by the IT department for the answers and questions?
So the content is managed by the professionals, but then the actual it's possible to change the text, and those that is done either by the IT department or then by us. So it's so whatever is kind of convenient. So sometimes the IT departments are outsourced or something, and it might be super complex and complicated to do any kind of changes, for example, to the website. So we've found it that it might be it is very often kind of like the easiest that we provide kind of maintaining the bot also as a kind of service to the client, and then they can talk about the problems to us, and then we can kind of interpret it into kind of bot behavior. So this way we can have a better end result faster, and there's like no information missing on the way. So that's a typical way. We also have a bot framework. Bot framework is a kind of interface that if you have already your own NLP type chatbot that you have trained, so it's possible to connect that to live inside Ninchat window, and then to perform escalation to humans, to have a video chat capabilities and attachments and all of that parts. So we have many customers who have done that. So if you already have your own chatbot, so you can connect that and to get the benefits of all of the further areas and notifier usage and all of those. So it's typically a couple of days of work to build an adapter that connects your existing, like we've done for Watson, Boost, Jenny Eyes of the multiple different platform, Microsoft bot system. So that's also a possibility when you already have a chatbot. So we can still kind of get the benefits from Ninchat even in that situation.
Thank you. Any questions from the nurses? So another use case that I can think of is that our nurses actually spend a lot of time when patient is being discharged. They follow up with the patient to understand, how are they getting along in terms of their recovery. So will this be something that will be a good use case to apply your solutions, where we can automate the nurses contacting the patient, because many a time they waste a lot of time because patient might not be able to pick up the call, or they are not answering the call, then they have to keep remembering to call them back again. Will this system be able to help them automate the whole process?
Yeah, that is a very good process to actually even have for the masses, because it would be possible. We have you could, for example, send SMS, say, hey, here's please answer the short survey. Click here, and then it opens in a mobile phone. Ninchat said, hey, I'm your recovery assistant. How is life? And let's answer a couple of questions. How it's been going since yesterday, and is there any questions or any kind of you like to thing? And then there's like to frequently asked common questions, and then if there's something that you know that is something that actually would be a good to assess with the nurse. So then only those cases that are kind of where the customer answers to a couple of questions that are kind of key questions in a way that you define, then it will only in that situations escalate to human. Otherwise, it will kind of report kind of as David. And this could be done in a way that it registers. So you could have like the patient recovery assistant queue, and then all of those would check that, hey, it's recovering nicely. When they press the button, it will store there, and then you would know that this patient ID 1, 2, 3, 4, everything is going cool. And then those that actually require assist, like escalation, to have a discussion, then you would have the on-call nurse would be using the, let's say, notifier, be alerted that, hey, now there's one people in the recovery group that needs to be checked, and then they, through the video consultation, could check the situation or make the decision whether the person needs to come in the further examination, or is it just something that they were worried, and make the prioritization decision, and so on. So it is quite easy to kind of reach masses through this system and provide this type of services. Yeah.
Thank you. That will be very useful then.
Okay, so I would like to thank you very much for this opportunity, and we are very interested in pursuing the area. So I've sent the presentation so it can be shared among all the participants, and also of course this if anyone who's like also looking at this recording, so is interested, so we're very happy to provide more information and have a kind of like short brainstorming sessions about like what kind of things could be tried out for you. So thank you once more.
Thank you, Will. Thank you, Ninchat. So here's my email. So for anybody who have further questions, or after this session you just have some other questions, just email to me. I'll follow with Will to get you the answers. So tomorrow there's only one more session. That's the last one, but later today there's two more, one from Alto and one from ESCOM. But tomorrow at 4 p.m. we have Optivo. They will be sharing their solution. So thank you everybody for attending this. Hope to see you in the next session again. Thank you. Bye.